If you are over 60, there's something your doctor may not have told you, and it could literally save your life. Every single day, millions of older adults wake up, reach for their medicine cabinet, and swallow pills they believe are keeping them healthy. But what if some of those very pills, the ones you trust the most, are quietly increasing your risk of a heart attack or stroke? Today, we are going to talk about 5 common medications that research has linked to serious cardiovascular dangers in people over 60. This is not about scaring you. This is about giving you the information you deserve so you can have an honest conversation with your doctor and protect your heart. Stay with me until the end, because the 5th one on this list surprises almost everyone. Before we dive in, let me be clear about something important. I am not telling you to stop taking any medication without speaking to your doctor first. What I am telling you is that you have the right to know what you are putting into your body and what the science actually says. Too many older adults are never told about the risks because doctors assume the benefits outweigh the dangers without fully explaining what those dangers are. You deserve better than that. So, let us get into it. The first pill we need to talk about is one of the most commonly prescribed drugs in the world for older adults, and that is the non-steroidal anti-inflammatory drug, better known as an NSAID. You probably know these by names like ibuprofen or naproxen. Millions of people over 60 take them regularly for arthritis pain, back pain, and joint discomfort. They seem harmless because you can even buy many of them over the counter without a prescription. But here is what most people do not know. When you take NSAIDs regularly, especially at higher doses, they can cause your body to retain sodium and water. This puts extra pressure on your heart and blood vessels. Over time, that added pressure raises your blood pressure and forces your heart to work harder than it should. Studies have shown that regular NSAID use in older adults significantly increases the risk of heart failure, heart attack, and stroke. The risk becomes even greater if you already have high blood pressure, kidney disease, or existing heart problems. If you are taking ibuprofen or naproxen more than a few times a week, that is a conversation you need to have with your doctor today. The second pill on our list is one that many people are surprised to hear about, and that is a certain class of diabetes medications known as older generation sulfonylureas. Drugs in this category have been used for decades to help control blood sugar in people with type 2 diabetes. On the surface, controlling blood sugar sounds like exactly what you want to do for your heart health. But the problem with some of the older drugs in this category is that they can cause episodes of low blood sugar, which is called hypoglycemia. When your blood sugar drops too low, your body goes into a kind of emergency state. Your heart starts beating faster, your blood pressure can spike, and the stress on your cardiovascular system becomes intense. In older adults, these hypoglycemic episodes are particularly dangerous because they can trigger dangerous heart rhythms or even a full cardiac event. If you are over 60 and taking medication for type 2 diabetes, ask your doctor specifically whether your medication carries a hypoglycemia risk and whether a newer, safer alternative might be a better choice for you. The third pill is one that shocks a lot of people because it is associated with something that is supposed to help your heart, and that is certain antidepressants, particularly an older class known as tricyclic antidepressants. Depression is incredibly common in older adults, and there is absolutely no shame in taking medication for it. Mental health matters, but the tricyclic antidepressants, which include drugs like amitriptyline and nortriptyline, have been shown to interfere with the electrical signals that regulate your heart's rhythm. In people over 60, whose hearts may already have some degree of age-related changes, this interference can be particularly dangerous. These medications can cause what is called QT prolongation, which is a disruption in the heart's electrical activity that can lead to an abnormal and potentially life-threatening heart rhythm. This does not mean you should suffer through depression untreated. It means you should talk to your doctor about whether a newer class of antidepressants might give you the mental health support you need without the same level of cardiovascular risk. Now, we are at the fourth pill, And this one is especially tricky because it is a medication that is very often prescribed precisely because of heart-related concerns. We are talking about certain decongestants and cold medications, particularly those containing pseudoephedrine or phenylephrine. Many older adults reach for these during cold and flu season without thinking twice. They are sold right off the shelf at every pharmacy and grocery store. But here is the critical problem. These ingredients work by constricting blood vessels throughout your body in order to reduce congestion and swelling in your nasal passages. The catch is that they constrict blood vessels everywhere, not just in your nose. That means your blood pressure goes up. Your heart has to pump harder. And for someone over 60 who may already have some degree of arterial stiffness or plaque buildup, that sudden spike in blood pressure and vascular constriction is genuinely dangerous. People with high blood pressure, coronary artery disease, or a history of stroke are at especially high risk. The next time you reach for a cold remedy, check the label carefully. If it contains pseudoephedrine or phenylephrine, speak with your pharmacist about a safer alternative before you take it. And now we have arrived at the fifth pill, the one that surprises almost everyone who hears about it, and that is certain proton pump inhibitors, or PPIs, which are medications taken for acid reflux and heartburn. You probably know these by brand names that are advertised constantly. Millions of older adults take them every single day because they have been told it is completely safe for long-term use. But emerging research over the past several years has raised serious questions about that assumption. Studies have found associations between long-term PPI use and an increased risk of cardiovascular events. One of the proposed mechanisms is that PP may reduce the levels of a molecule called nitric oxide in the body. Nitric oxide is critically important because it helps your blood vessels relax and stay flexible. When nitric oxide levels drop, your blood vessels become stiffer and less able to dilate properly, which can raise your cardiovascular risk. Additionally, long-term PPI use has been linked to magnesium deficiency, and low magnesium levels can contribute to irregular heart rhythms. If you have been taking a PPI every single day for months or years, it is worth asking your doctor whether you still need it at that dose and whether there are lifestyle changes or alternative treatments that could allow you to reduce or eliminate your reliance on it. Now, here is the most important thing I want you to take away from everything we have talked about today. The goal is not fear. The goal is empowerment. Your doctor is not your enemy, and neither are all medications. Many of these drugs, when used correctly and monitored properly, genuinely save lives and improve quality of life. But the medical system moves fast, appointments are short, and risks do not always get communicated the way they should. You are your own best advocate. Write down the medications you take. Look them up. Ask questions at your next appointment. Ask your doctor what the risks are, whether there are safer alternatives, and whether you still need every pill you are currently taking. Medication reviews are especially important as you age because your body processes drugs differently after 60, and a dose that was appropriate years ago may carry different risks today. Your heart has been working for you every single minute of your life without asking for anything in return. It is time to start working for it. Share this video with someone you love who is over 60, because this information could genuinely make a difference in their life. Leave a comment below letting me know which of these 5 surprised you the most, and let me know if there are other health topics you want me to cover. Every comment helps this channel reach more people who need this information. And if you are watching this and you are not yet subscribed, please take a moment right now to subscribe to this channel. Hit that subscribe button and turn on the notification bell so you never miss a video. We publish content regularly about the health topics that matter most to people over 60, covering real, research-backed information in plain language that you can actually use. This community is growing every day because people are tired of being kept in the dark about their own health, and together we are changing that. Subscribe to my channel and let us keep learning together.